Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy, and Medicare for All. This is the plan that many of the Democrat candidates for president support. Bernie Sanders has introduced legislation. Kamala Harris has signed on. And that was the occasion for a second conversation between Jake Tapper and Kamala Harris, who, in their previous conversation at a CNN town hall, said that private insurers had to go. And she clarified it subsequent to that. And she tried again to clarify it in a sit-down with Jake Tapper this weekend, why she supports Medicare for All, but is not a proponent of eliminating private insurers. See if what she had to say makes sense to you.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch the tape, I think you'll see that there are obviously many interpretations of what I said. What I meant is let's get rid of the bureaucracy. As it relates
to Medicare.
But the bill
gets rid of insurance.
But no. It does not get rid of insurance. It does not get rid of insurance. And listen, and let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for All. It is my preferred
As a principle,
policy.
you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Well, because the bill gets rid of private insurance for everything that
it doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all...
So it doesn't get rid of all insurance.
Okay, it doesn't get rid of all insurance,
right.
but for all essential health care benefits.
But why? Ask the question why. The question... the answer to that question is because Medicare for All and the vision of what it will be includes an expansion of coverage. So Medicare for All will include vision, it'll include dental, it'll include hearing aids.
A little curious, it doesn't get rid of all private insurers, but then ask yourself the question of why it effectively gets rid of all private insurers, sort of arguing the alternative, as any 2L law student will be able to do, and that was, I guess, good enough to get by Jake Tapper, not me. What about Dr. Ezekiel Emanuel? Ezekiel Emanuel is an oncologist, a bioethicist, and a vice provost at the University of Pennsylvania. He's the author and editor of a number of books, including Brothers Emanuel. Is that a takeoff on Brothers Karamazov? And Reinventing American Healthcare. He's got a piece in The Atlantic, and I can't believe I'm about to say it with this.
It's all right.
That I, in part, agree with. So let's, I guess, see if we can forge deeper understanding and collaboration. Dr. Ezekiel Emanuel, thanks so much for joining us. Appreciate it.
Nice to be here.
So your piece in The Atlantic suggests that Bernie Sanders' Medicare for All plan is not something, I don't know if that you would support is a proper characterization, but certainly you don't think will be supported by a majority of Americans.
Well, I think I say it's not feasible for a reason, and the reason isn't that a majority of Americans wouldn't support it. Part of the issue is what exactly do you mean by Medicare for All, but the bigger part of the reason, if you have a plan that will effectively eliminate the role of private insurance, both from the employer market, where about 175 million Americans get their insurance through their employer, and you say, those people aren't going to get private insurance anymore. Private insurance companies are effectively going to be eliminated from that part of the market. Maybe they'll be left in Medicare under the Medicare Advantage or Medicare Part C part of the market, but that would be a huge eliminating them from private employer-sponsored insurance would be a huge cut in their business, and they would fight that with everything they have because essentially, if they're not going out of business, they're being scaled way back. And I think, that we have seen this television show before, and that television show ends up with a piece of legislation not getting passed. In addition, a lot of Americans, while they quote-unquote hate insurance companies, and it's easy for politicians to beat up on insurance companies, they actually have a soft spot for their insurance company, or at least they want to be able to choose whether they have an insurance company or not. And so when you say to Americans, well, we're going to get rid of your insurance company, they suddenly become a little more hesitant about that proposal. Now, some of that may be they don't like change. Some of that may be there are some things about their insurance company and their insurance arrangements they like. But I think I just don't see it as a politically feasible alternative. No country that I know of has ever eliminated a $1 trillion industry. It's just very unlikely that that's going to happen. And rather than make this, you're either Medicare for all, get rid of all the insurance, or you're not, there are many things we can do to improve the American healthcare system, and that is not the hill to die on, in my opinion.
What can we do, or what should be done?
Well, so first of all, I would say that the American public wants three things and ought to get three things. The first is they want to be sure that there is universal coverage, where universal means universal. It means 99%, 100% of the population is covered. We're now at 87% again because of President Trump. The uninsured rate has gone up. And Americans want to know, if, God forbid, there's a big recession or a depression, they lose their job, they lose their health insurance, that they have a adequate plan that is not unaffordable to them. And every time you chip away at the Affordable Care Act, you chip away at the guarantees that were put in that, Americans get nervous. They want security and they want universal coverage, and know that they and their children and their parents are going to have coverage. And so we have to guarantee it. The easiest way to guarantee it is auto enrollment. You don't have to go in and select a insurance company. You don't have to try to prove that you're impoverished. You're a resident of America. You are automatically enrolled in a plan. Maybe it's Medicaid, maybe it's Medicare. Auto enrollment works in every other country, and we should have a version of auto enrollment. We can figure out what it is, but that will get us 99% coverage, and that's what we need, no matter what, where you are. The second thing Americans want is affordability. They actually want healthcare to be less expensive and less expensive out of pocket, and that there are two or three things that have to be addressed there. The first thing is we have to address drug prices. We have the highest drug prices in the world by far. The next highest country is about a third less than the United States in terms of per person spending. We have to address drug prices. The second is we have very high hospital prices, especially for people with private insurance. Hospital prices have to be brought down. They have to be made more rational, not varying, so that there's a five-fold price difference between one hospital and another for the exact same procedure. And the third thing is we've recognized that we're paying doctors to treat sick people. We're not paying doctors to treat healthy people. And to keep people healthy, we need to change how we pay doctors. We call this alternative payment in the medical health policy lingo. We need to not pay every time they see a patient. We're going to give you a pot of money. You're going to take care of these patients, and you're going to keep them. It's going to be on your responsibility to keep them healthy. If they go into the hospital, you're going to see that financially. And that, we know, can make a big difference in affordability. And the third thing Americans want is simplicity. The system is too complicated. It's too complicated for people with PhDs. We should not have to figure out, is someone in network, out of network? I go to the hospital, it's in network, but is the emergency room doctor in network or out of network? Yeah. This is insane, and we need a much simpler system.
There's nothing, there's nothing that, no institution that simplifies things and brings costs down like government, right? I want to get to affordability and simplification.
Well, wait a second. Excuse me. In healthcare, it is the case that government pays less than the private sector.
Well, yes,
absolutely. Medicare is lower cost.
Yes, right. Price controls work in the area of health insurance, even though they work in no other sector. When Medicare was created in 1960, I'm sorry, I'm not done. When Medicare was created in 1966, the projection was cost $10 billion a year. By 25 years later, it was 10x that. Now, as you know, Medicare is functionally insolvent because payroll taxes don't nearly cover the liabilities Medicare throws off on a real-time basis. So that's just not true.
Well, first of all, there's a lot of reasons for that, and it's not exactly the way you put it. It is the case that as that medicine has developed new treatments and that has increased the cost, and we do need to bring down the prices of those interventions, and doctors use the interventions well beyond what initially was projected. So I do agree with you that there's an upward swing to healthcare costs. That has got nothing to do with the government paying. It's got to do with what medicine does. By the way, private insurance has gone up faster than Medicare costs have gone up, in part because Medicare can set prices, and that is actually in the healthcare sector a good thing.
Yeah, and because you have government was the largest purchaser of health care services before,
That's right.
Before
That's
Obama,
right.
Before
and
Obamacare,
it power
and it dropped.
in an effective
Yeah,
way.
it uses its power. Well, okay. I want to get back to the proposal you actually support and the choice piece of this. The Center for American Progress's auto renewal proposal that you were describing. Doesn't this ultimately get you to the effective elimination of private health insurance? The bill permits people to opt out of the government program only if they have, quote unquote, qualified health care coverage from an employer. And even then, employer-provided health insurance would soon disappear because employees would be able to enroll in the government program without penalty, but their employers would have to pay an 8% payroll tax as soon as even one employee opts into the government insurance. So why would any employer provide a private health insurance, a qualified health care coverage to their employees when they're penalized for doing so and their employees can enroll free, quote unquote, into the government program?
No, so I don't think you're exactly characterizing it. The idea behind the Center for American Progress's position is both to simplify the system and to have this auto enrollment mechanism, but also to allow people to allow employers to continue to offer private health insurance, people to stay in that private health insurance, but also to have an option, a choice, which we love in America, choice of if they prefer the Medicare option, moving into the Medicare option. And that essentially boils down the healthcare system into three possibilities. You have private employer-sponsored insurance, you have Medicare, the traditional Medicare, and then you have Medicare Advantage, where people can choose among the private plans in the Medicare Advantage arrangement. That simplification is a very good thing. Auto enrollment is a very good thing, and this does keep the prices down and the total cost of healthcare down. So you retain choice, you retain private insurance, you give people auto enrollment, and you give people a very secure safety net of Medicare under them. There's nothing not to like about this plan.
What happens to direct primary care physicians that operate on a fee-for-service basis? If they operate on a fee-for-service basis, you're a doctor, you're a patient, you want to go outside your insurance arrangement, you can. They're not made illegal. It's just not insurance. So the Center for American Progress's proposal is about health coverage. Now, it's very unlikely that a lot of Americans are going to go outside or could afford to go outside their insurance for the bulk of their care. It's very important that we have a situation where everyone is in the pot. Every other European countries, including the favorites of conservatives like Switzerland, require people to be covered and have insurance And in Switzerland, we're not talking namby-pamby $600, $695 penalty. We're talking about the equivalent of the premium. And by the way, if after 3 months you don't sign up for a health insurance plan, they automatically sign you up for a health insurance plan and take the money out of your paycheck to pay for it. That's free market Switzerland for you, because they understand that if you're going to have a functioning health insurance market, everyone has to be in, and it can't be, no, I'm not getting it until I get sick, and then I'm going to shove all the costs on everyone else, being irresponsible. So
people who opt out of the health insurance system are totally irresponsible. They're relying on everyone else to keep the system going, just so when they can use it, they go in, and then the cost is going to be paid for by everyone else. That is not socially responsible or individually responsible.
Yeah, but they're
That was the
they're
aspect of
incentivized to do it. I mean, they're incentivized. What do you mean? So then the policies, the government policies, that incentivize.
You're the guys. Wait, you're the Republicans are the people who took away the mandate.
Excuse me. What's the Medicaid program? Using emergency room as your primary care physician. What are the incentives there, and who presents those incentives?
Well, I'll tell you what the incentives there are, and I do think we need to break down that barrier. And by the way, that's not break down that behavior and that habit. And that's, by the way, given the incentives that are created in the Medicaid system, a perfectly rational behavior. Lots of physicians don't take Medicaid. It's very hard to get a primary care appointment.
And why is that?
And as a consequence, because a lot of doctors don't take Medicaid.
Yeah, but why?
Because they don't get paid.
Wait a second. As a consequence, and they don't keep their hours open late when, most of the Medicaid people in this country, the vast majority of Medicaid people.
Hello? Did he just turn 75 years old and he passed away?
Oh.
What happened to Ezekiel Emanuel? I don't think he hung up. I think he got cut off because he was
did.
in midpoint.
Well, I wanted to ask him why his brother isn't running for mayor again.
Because nobody likes him. There's your answer. We'll come back, try an effort to get Zeke back to continue our spirited conversation.
It's news, opinion, insight. This is Chicago's Morning Answer on AM 560. The Answer.
I'm Lou Dobbs. Macy's customers, as its CEO, may feel the impact of the trade war with China. Walmart quarterly financials out today, and North Carolina sues e-cigarette maker Juul. Those stories next.
Your cell phone's connected to your tablet's connected to your laptop's connected to your Wi-Fi. 1 weak link and thieves are in.
The digital world is so connected these days, it just takes 1 weak link for criminals to get in. Good thing LifeLock Identity Theft Protection includes the power of Norton Security to watch out for threats in today's connected world.
Your desktop's connected to your smart TV. Your smart TV's connected to your smartwatch.
Threats to your identity, like your info for sale on the dark web, and online threats to your devices, like ransomware. No one can prevent all identity theft or cybercrime or monitor all transactions at all businesses, but LifeLock with Norton detects a wide range of threats to your identity and devices. And if there's a problem, our agents will work to fix it.
Your smartwatch is connected to your video doorbell. Your video doorbell's connected to your smart lock.
Join now and get 10% off your first year. Go to LifeLock.com and enter promo code TITTLE for 10% off. LifeLock with Norton. More detection, more protection.
Macy's stores loaded heavily with Chinese imports, and that increase in tariffs of 25% may hit those customers affected by those tariffs. Chinese shirts, toys, sneakers, household goods. Macy's CEO Jeff Jeanette warning his investors he can't imagine his store's customers won't feel the economic effect. E-cigarette maker Juul sued by North Carolina's Attorney General. The Attorney General wants the courts to limit flavors that Juul can sell and to put safeguards on underage teenagers able to buy vaping products. Economic reports out today include Walmart reporting its quarterly profits and the Commerce Department reporting housing starts for the month of April. Please join me for Lou Dobbs tonight, 7 o'clock and 10 Eastern on the Fox Business Network. This is the Lou Dobbs Financial Report.
AM 560. The Answer.
Dan and Amy, we lost the connection with Dr. Zeke Emanuel, but I think we have him back. Dr. Emanuel, are you there?
Yes, I'm back.
Okay. So
you get a little paranoid when you're making a really important point.
No,
and,
no.
You suddenly get cut off by the right wing.
No,
we didn't cut you off. That was not on our end.
I would never cut you off. So finish your.
It must have been AT&T or the National Security Agency.
That's right.
Anyway, I'm joking. I'm joking with you, obviously.
We know.
So let me just
finish your point on Medicaid.
Let me just finish my point. So there are many reasons that in the Medicaid system, again, most of the people in Medicaid work. They work 1, 2, 3 jobs. They just don't get insurance through their employers like fast food restaurants or retail. And they can't go to a doctor during regular business hours. They have to go after hours. Lots of doctors' offices aren't open or don't have coverage after hours or on weekends. And the result is emergency rooms. You have to change that behavior, and I agree with you. It's bad behavior. But by the way, people on Medicaid are not the only ones who have bad behavior regarding the emergency room. Lots of private people with private insurance do the same thing.
Yeah, but
it's a behavior change. Wait a second. It's a behavior change. Behavior change takes time. It also requires physician offices to take Medicaid, to stay open late, to have coverage on weekends. And those are things that the medical profession has to do. We know, and I wrote an article in the New York Times, that when you actually educate people about the difference, you show them where they can use urgent care instead of the emergency room, they will, over time, and it does take time, change their behavior and go out of the emergency room. So that's possible.
But I just want to. So reimbursement rates and payment cycles have nothing to do with the Medicaid problem. Doctors not taking Medicaid patients.
Oh, no. We do know that payment to doctors can make a big change. When we passed the Affordable Care Act, we increased the payment for Medicaid to doctors, and more doctors took Medicaid patients, and doctors who took Medicaid patients took more of them and made appointments more rapidly. And so I am all for increasing the Medicaid reimbursement to doctors. I think that was a good policy we had in the Affordable Care Act. Unfortunately, it was temporary rather than permanent.
Dr. Zeke Emanuel, we're up against the clock, but I'd love to have you back. This issue is not going to go away because we need more time to get into some of these nuances, but I do appreciate you coming on the show. Dr. Zeke Emanuel, oncologist, bioethicist, vice provost at the University of Pennsylvania. Dr. Emanuel, thanks for joining us. Appreciate it.
Thank you, and sorry for the connection.
No problem.
No problem.
Thanks. He joined us on our